a very short discussion, and then we will have a small break and then get on to the development of the cardiovascular system. Okay, is that all right? Now, I would like somebody, either the batch rep, who is the batch rep currently?
It's me, madam.
Mihit, is it you?
Yes, madam.
Okay, right. Yeah, so if there is any audio break or video break or any problem, you have my telephone number, you can call me, right?
Okay, madam.
Okay, so
recording
now,
in progress.
Let's start with the next week's preview. Actually, this short overview is for you to, as students learning about a new region, to kind of have a glimpse of the region that you are going to do. So now we have already done the chest wall, okay, thorax we have started, and you have already done the chest wall. So now we are going into the mediastinum and the heart. So roughly the objectives would be to define what mediastinum is, and to describe the subdivisions and their contents, and then also to see and identify and learn about the contents, about the structures and their relations which are within these subdivisions, and also to identify these structures in a cross section using the cadavers or atlas pictures as well as CT and MRI images. Okay, so that is basically what you have to do about the mediastinum. Then we have the next topic, that is the pericardium and the heart. So as you know, the pericardium is the cavity surrounding the heart. So you have to learn the structure, how it is made up of, and then also about a little bit about the clinical correlates. Then the heart is a very important organ because if you take the morbidity and mortality both, the heart is a very important structure where the disease conditions and the death of patients would be involving the activities of the heart. So therefore, this is a very important region. So first, the foundation has to be laid properly about the structure. So that is why you will have to learn about the heart. So when you are learning about the heart, you have to learn the structure, basically the surfaces. There are two main surfaces, sternocostal, diaphragmatic, and also the base of the heart. And then the borders, the right border and the left border, you will learn about these later, as well as the base and the apex. Okay. Then about the chambers of the heart, you will have to learn a little more in detail. When you get the chance, you will be able to see the dissected specimens, maybe dissect on your own, and then see and feel the structures there. But for the time being, we are going to learn the theory part first. So get the atlases and then learn the structure of the chambers of the heart. Then some more concepts about the heart. Now this heart is a muscular organ, and it should have a very good arterial circulation and a venous drainage. So you have to learn about the coronary circulation, because one of the most important clinical conditions, myocardial infarction, or in layman's terms, heart attack, is due to problems in this coronary circulation. So therefore, you have to learn about the coronary circulation in detail. And then another aspect is the conducting system of the heart and their defects. So as a basis to learn the physiological activities of the heart, you will have to learn about the conducting system of the heart. Then also the surface marking of the heart is important, and you have to understand where the cardiac valves are located and where the abnormalities in these valves will produce abnormal sounds and where they will be projected. So auscultation is by getting information by listening to the heart. Okay, so auscultation is getting information by listening. So cardiac auscultation, you can with your stethoscope, later on you will have hands-on experience. So before that you have to know the theory behind it. Okay, so these are the main objectives. So we will just go through some of them very briefly, and then come to how we are going to do that. Okay, so as the foundation, you have to learn, revisit the thoracic wall and the bony skeleton, because we will main bony points that you have to learn about. So where the heart is located. So the first mark is important. Therefore, where is the second intercostal space? Where is the sixth intercostal space? Where is the fifth intercostal space? All that is important, because the heart will be underlying is located to the bony structures here. Then you also have to be able to feel and locate them, because there are some emergency situations. You have to insert a needle and do some procedures. For example, pericardiocentesis. So some of these terms are new. So as you go on, you will learn. That is, if there is pericardial effusion, you have to remove that. So you will do that by causing minimal harm, minimal damage to the other structures. So that you have to learn, and therefore the thoracic wall and the bony skeleton references are important. Then we come to the mediastinum. So what is the term mediastinum? It's a new term. You may not have learned about it earlier. Mediastinum means a septum or a membrane or a thick membrane. Okay, so where is this thick membrane located? It's located behind the sternum and posterior to the sternum and anterior to the vertebral bodies. So this is where the septum is located. So it's like a bag. Okay, it has two lateral walls on either side like that. So it's like a bag. So outside the bag, the lungs are there, and inside the bag, basically, you have the heart mainly, and also you have the other structures passing from the head region into the neck region, from the neck region into the abdominal region. Okay, so vice versa, the structures that pass through will be going in this middle septum. That is what the mediastinum is. It's a septum. So these are some of the structures that you would see, and depending on the level, you have different structures. So you can see it in this also in a radiological imaging also. You will see the mediastinum, a septum, the middle septum or the mediastinum behind the sternum and anterior to the vertebral body. So this is where your mediastinum is. So that is what you have to learn. As medical students, you will learn more details. So if you take the extension of the mediastinum, you can see that where it extends from anteriorly, you can see the mediastinum starting from the manubrium here. Okay, and then you can see how the vertebral bodies form the posterior border here. Okay, and then for convenience of description, this mediastinum or this medial septum is divided into different compartments. So basically the first compartments, the first division is the superior mediastinum and the inferior mediastinum. So here from the first thoracic vertebral body to the fourth thoracic vertebral body posteriorly and in the region of the manubrium sterni. So you have the here the superior mediastinum. And as you know, this demarcation is important. This is called the sternal angle. Okay, so the anteriorly it is the sternal angle or angle of Louis, and then you have learned about that. And then posteriorly it is the disc between the fourth and fifth thoracic vertebra. So that is the imaginary line, and above that you have the superior mediastinum. And then the rest which lie below that is the inferior mediastinum. So we don't call the inferior mediastinum because we divide that into three main areas. So that is the anterior mediastinum, middle mediastinum, and the posterior mediastinum. So out of these compartments, the middle mediastinum is the largest one, and that is mainly occupied by the heart and the pericardium. Okay, so those are the basic divisions of the mediastinum. Then you can see the pictures here. So you will have to also see the relations, how the other structures are related, and this mediastinum is connected to the lungs through the hilum of the lung. Okay, so that is where the structures that pass into the lung would be communicating with the mediastinum. So you can learn the structures. Here you can see the thoracic aorta on the, if you see it from the left side. If you view it from the right side, what you see is the azygous vein and the superior vena cava. So these are the structures that you would see from the right side. So you have to learn what you see, because if there is any lesion, then they will be involved. So the other thing is the structures, you have to learn the relations also. And one important level where you have to learn the relations is the level of the sternal angle. Okay, so level of the sternal angle is important because so many things happen at this level. So you can go through, and it's there in the clinical anatomy by Harold Ellis also. So learn those things, what happens, and that will give you a picture. So of the structures that will be going and coming. So here you have to read and then make your own 3D picture, right? So that is about the sternal angle. And then when we come to the heart, what you have to learn basically is about the pericardium. You have to read and understand. And then you can also, you have to learn about the surfaces, as I said, the sternocostal surface and the diaphragmatic surface and the right border and the left border. This is the superior border. Okay. So this is the diaphragmatic surface is this one, and the base of the heart here. So all these, when you get the chance to come and see the actual cadavers, you will be able to feel them. But for the time being, you have to learn with the atlases and the videos. I will tell you how to do the learning in a little bit more detail later. So the chambers, they may look a little difficult maybe at the beginning, but if you learn how they are formed, then you can, it's like a uncharted or a unmapped country. So if you know the landmarks, then it's not too difficult. So learn and find your way through the chambers. Okay. The other important thing is the arteries of the heart. So the coronary arteries, the right coronary artery and the left coronary artery, and what is the cause, what are the main branches, and what are the areas of supply. That is what you have to know. And then also what are the veins that accompany these main arteries. So that's also important. The assessments will be later on. We will ask you different structures we can ask you, and you have to identify them in the auspice, right? Then the conducting system, this is basically theory only, because structurally we are not able to identify any of these. But for your understanding in physiology how the electrical activity happens, it's important to know where the conduction system is. Okay, starting from the sinoatrial node here, which is the main pacemaker, then going on to the AV node and the rest of the conducting system. So that's also important. Right. Then lastly, the auscultatory areas. So the valves are there. As you know, you have to learn about the valves. And these valves, when they close, they make a sound. But if these valves are not functioning properly, either if they are not closing properly and if they let the blood flow after they are supposed to close, or if the valves are narrowed and enough blood is not going through, then it will make a sound. So these sounds are called murmurs. Okay, so these murmurs are projected onto the precordium or the surface of the chest wall. If you listen with your stethoscope at this particular site, you can identify a abnormal sound or a murmur more precisely, more easily you can listen to it. So for example, each of these valves are supposed to project the noises or the sounds that they make into different areas. So if you know where that area is, and if you can hear a murmur most loudly in this area, then you can have a you can make a opinion that it is there, the structure that is involved is this particular valve. For example, if you can hear a murmur at this site, at the apex, which is the, can you tell me where the apex beat is? Let's see whether you know. Where do you hear the apex beat, where the mitral valve is projected? Can somebody tell me? Where do you feel the apex beat? You can, on your chest wall also you can feel that. Which intercostal space is that? Yes, it is the fifth intercostal space. And then what is the y coordinate? What is the, so it's the x coordinate is this the fifth intercostal space. So what is the y coordinate here? It's the mid clavicular line, midpoint of the clavicle. Okay, just medial to the mid clavicular line here. Okay, so that is where the apex beat would be. So likewise, the other areas also you have to learn and identify, and you should be able to do it on a living person. Okay. So likewise, that's about the briefly about what you have to do. How are you going to achieve these things? How are you going to achieve these things? Yes, we will be having SGA on 2 days. So that is on Monday and Tuesday. So Monday there will be a small lecture on mediastinum. Dr. Udari will be doing that. And then she will also take a discussion. Okay. What you have to do is to learn on your own and then participate in these discussions also. And then I will do the second day, Tuesday, I will take you through some of the structures, and I will upload the lectures because it's a long lecture. I will upload it, but you will have to listen to it before you come to the discussion. Okay. So that will also be uploaded. So during the weekend also, you should be able to do that. And then there are videos which are in your LMS. So if you go through your LMS, the data usage will be minimum. So go and see those videos that are given in the LMS slots. Because you're missing the actual cadaver dissections, these videos are very good. So go through them. Each and every one of you should see these videos, right? And also I will be uploading a quiz. So do that quiz before end of Monday, right? And we will be discussing it on Tuesday. So what you can do is do it as soon as possible. Today itself do it as a pre-test, and then as you study, you will know what is important. And then at the end of studying also, again go through the quiz questions and see whether you have understood. Okay. So that is the plan. Okay. And apart from that, now Professor Vajra is unable to do the cardiovascular system development. So I will be taking that lesson as well. So, so now immediately after this session, I will start with the development of the cardiovascular system. I will do one part today, and the second lecture will be on Monday, because if I do both lectures today, you will not have enough time to go through the first one and understand that and then come prepared for the second one. So that's why the second part will be on Monday, right? Is that okay? Any questions? So basically, you can read as many books as you want. Last Anatomy, Chaurasia, then Clinically Oriented Anatomy by Keith Moore is there. Then Cunningham's Anatomy by Cunningham's is there. Cunningham's Manual of Practical Anatomy. I think it's good if you can have the PDF versions, and then if you want to, if one book is a little boring or you can understand, go to the other book, and then different chapters you can read in different ones. That's okay, because it is the anatomy. It's not one person's have the textbook that we want you to learn. It's the human anatomy that we want you to learn. It's not like a not like the A-level days where you have to write the same things that are given in the teacher's guide or whatever. So it is the understanding that we want from you, the basic facts. So the other main reference book is the Gray's Anatomy, if you have any doubts. Okay. And also use the YouTube videos, which are very good actually. So they will, the time you spend on reading a lot, you can grasp that idea by watching a video which is now available at your fingertips these days. Okay. Any other questions you have? Any of you have any questions? You can put them in the chat also if you have any questions. Yeah, so we will keep the same.